Welcome again, everybody, to a new series of videos about the intraoral radiographic anatomy. And after we have finished the anatomical landmarks of the maxilla, today we are going to talk about the anatomical landmarks that are seen in the mandible, and as in the maxilla, actually anywhere in the, regardless of the jaw position or the skull position, anatomical landmarks should be studied thoroughly, because as we know, because of the importance of differentiating between what is normal and what is abnormal, so that we don't want to mix up between anatomical images of anatomical entities and misinterpret them as disease, especially and this is mainly because of the fact of superimposition of structures in this 2D type of imaging. And the other thing is that there are lots of superimposed structures like soft tissues and air shadows and foramina and these things. All these will tend either to exaggerate or mask the effect of disease, if any. Okay, so to start with, we will start just like we started in the maxillary teeth. We will start from the center, and this is a radiograph of the image of the lower centrals and laterals. Of course, this is all in one radiograph, and the canines, of course, part of them will be seen. In this radiograph, we want to see, starting from the top, we want to see the effect of the shadow of the image of the lip. Image of the lip, as was in the anterior teeth. Problem here is that you always see a line. See this line over here that is covering, starting from here all the way. This is actually, now if we have the ability to decrease the density, radiographic density of the radiograph, we would have seen the shadow of the lip that is crossing all over the teeth. Of course, it differs. Some patients the lip is high, some patients lip is low. So you will see it just like you see it in the upper teeth. The part of the teeth is covered. However, this is more likely in the upper teeth, where the lip goes up high, so that it will tend to cover part of the teeth. In this radiograph, also in the lower central incisors, I want you to have an idea about the type of bone trabeculation in the lower jaw teeth, or in the mandible, and the bone trabecules and the bone marrow spaces. Unlike in the upper jaw, we agree that in the upper jaw the trabecules tend to be lace-like, irregular. They don't have a special pattern, and they are narrow. The spaces are, more bone marrow spaces are narrow. In the lower jaw, the trabecules are more or less horizontal. They run horizontally, and they are coarser. It means they are thicker. The bone trabecules are thicker. Hence, the bone marrow spaces appear smaller. So, in this radiograph, you see the thick, coarse, horizontally running bone trabecules. On the other hand, you will see the smaller sized bone marrow spaces, usually that which are scattered in between the bone trabecules. This line which crosses the see here. See this line? This is actually the alveolar bone. This is the level of the alveolar crest. You will see it as a line crossing all over the teeth. Line crossing, and if you concentrate, you will see that this radio opacity goes all the way down. See? Now, in this radiograph, this is the level of the alveolar crest, and this is the CEJ, cemento-enamel junction. You see this area? I hope, excuse me, I hope you know this by now. This is just like we've seen in the anterior teeth. This is cervical burnout, which is the area we said it is neither covered by bone nor covered by enamel. It's only covered by the cementum of the root and dentine, so it will allow more X-ray to pass compared to the enamel and dentine and to the cementum of the crown and the cementum and dentine and the bone of the root, so it will appear more radiolucent comparatively, which we call it the cervical burnout. This is the alveolar bone level. As you can see here, that it extends very clear across the of course this is in a normal or in a healthy periodontium. Have a closer look at this radiograph. You will see that there are longitudinal lines that run from almost from the alveolar crest, if it shows, downwards almost to the lower border of the mandible. These lines are, you usually see them in patients who are hypertensive, or you will see them in obese patients. These are nutrient lines. These are passages of blood vessels from the alveolar crest downwards. Sometimes they tend to be wider, and they run in this longitudinal movement from the alveolar crest downwards. This is normal presence, although we don't see it in all patients. As we said, it's more common in hypertensive patients and in obese patients. These are the nutrient canals. It doesn't represent any pathology, but if we see it or if we see them, we should know what these lines are. Of course, the width of these lines differs from one patient to another. It also differs by by age of the patient. Okay. Another radiograph in which you will see the lingual pit. Lingual pit is a small, can you see it here? It's a small notch. It's not a foramen. It's a pit which is located on the medial surface of the mandible. You will see it closer to the alveolar border, away from the roots. This lingual pit, it might appear a bit, in some patients, bigger, which more or less gives the appearance of a foramen, and in some cases it's just a small notch. So this is the lingual pit, and see here in this radiograph, for instance, it appears bigger, this one over here. So this is anatomical variation from one person to another. So if you see radiolucency, it is almost in the midline. I can't say it is in the exact midline. It is located on the lingual surface of the mandible. Okay, the size differs. It is a radiolucency that ranges from a small pit to a foramen, and this is surrounded by the genial tubercles, which I will show you in the other slide. Now, if you see in this radiograph, you will see that there is a radio opacity on either side from the midline. This is the midline over here. there is a radio opacity located apical to the teeth. It runs in either direction. Okay, this is called the mental ridge. This is the mental ridge which is present on the lingual surface of the mandible.